for patients that have high blood pressure and that they're concerned about taking, medications and the long-term effects of what, those medications, and they're looking for natural means, upper cervical chiropractic, NUCA, Blair, could be a very real possibility for them. So we would encourage them to give that a try. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Okay, welcome back everyone to the Upper Cervical Chiropractic Research Show. This is episode number 23. I am Dr. Kevin Leach, and here with me once again is Dr. Tyler Evans. How are you, sir?
Good to see you.
Good to see you. So this episode's research review is titled Atlas Vertebra Realignment and Achievement of Arterial Pressure Goal in Hypertensive Patients, a pilot study. This is by Bakris and Dickholtz. This is in the Journal of Human Hypertension. This is a pretty famous study, at least in our community and in our world. I'm sure you've done this on your research moment for your practice, and I've actually reviewed this as well for my practice as well. And there's a video on YouTube about that, but we figured it was important enough to do again. So the goal of this paper obviously is to bring more awareness that, upper cervical chiropractic care, and in this case, the NUCA technique, can do wonders for, patients with high blood pressure. Not all of them, obviously, but some of them. So what was the conclusion you just read me before we started to record here, Dr. Evans, with the results?
So the conclusion, it's in the abstract there, is that no adverse effects were recorded. We concluded that restoration of atlas alignment is associated with marked and sustained reductions in blood pressure, similar to the use of 2-drug combination therapy, which would be 8 millimeters of mercury. Lowering blood pressure 8 millimeters of mercury is 1 drug, and 10 was the goal, and that's a 2-drug combination therapy, and we did achieve that. So that's that goal. They achieved the goal. They lowered it 10 millimeters of mercury across the average of the patients.
Got it. So this was a pilot study. So there were 50 patients, half and half placebo, half not, and they found a significant change with the hypertension. What is it? The type 1 hypertension. Type 1. All right. Cool. And so this was done. What year was this done?
Yeah, it was published in 2007.
I mean, what are your thoughts? This paper overall is pretty groundbreaking, right? It's the first either chiropractic or upper cervical chiropractic paper in a medical journal. Correct? Journal of Hypertension.
I don't know. I don't know that one.
I think it is, or at least it was one of the first, and that's why it was a really big deal. Because the Journal of Human Hypertension, I mean, it's a medical journal. It's medical. Right. It's has nothing to do with the chiropractic profession. And a lot of our research is obviously in chiropractic journals because we're the ones doing it. But it was kind of groundbreaking in that sense.
Right. And Dr. Bakris, he is one of the department heads, I believe, at Rush University Hypertension Center in Chicago, which is I believe, the largest hypertension center in the United States. I could be wrong, but it's definitely one of the biggest, and that is a big deal. Dr. Dickholtz, who you and I have both mentored under, I actually went and visited him in practice before he passed away. in 2009, I think, or 10, which was amazing. The guy was just brilliant adjuster and chiropractor. But he's the one, Dr. Marshall Dickholtz, he's probably one of the founders of NUCA, of the technique that you do, Dr. Leach, and amazing guy. Definitely did some groundbreaking work here with Dr. Bakris because he lives in that area. They live in the same area there in Chicago, so that's how they got connected. I think they shared patients probably, and I think Dr. Bakris was sending him patients.
They were. I'm pretty sure they worked together. I think it was probably just a mutual patient kind of thing. He probably had a couple patients that were getting help with lowering blood pressure, and then they probably connected and worked together more, and then decided to do some research. And Dr. Bakris being in the medical field, getting a medical doctor on the research team, and then getting it published in a medical journal is probably that specific pathway.
Yeah, and briefly too, to do a double-blind placebo controlled study is, I think this was the first of those in chiropractic. I could be wrong there, but it's definitely one of the few, if it's not, the first. So, I think that part, the part that, he's with Dr. Bakris, the money that it would have taken to get this study done is, it's a lot, right? And so that's why these studies don't get reproduced a lot, because it requires the collaboration and contribution from, financially, people with not a lot of time, not a lot of free time to get around and do this stuff. So this was really, and Dr. Dickholtz had been in practice I think he was 80 something when this study was written. So he'd been in practice for probably 60 years, and he was at the top of his game. So we'll talk about it later, but there was a follow-up study done to this with the money from the NIH that we need to just establish, okay, that didn't go the same, right? And we can talk about why, but Dr. Dickholtz was a very established, highly trained upper cervical chiropractor.
Great. Yeah. Well, and that's one of that's actually says that as part of a limitation of the study is the skill of that practitioner. And Dr. Dickholtz was incredibly passionate about the technique and extremely specific, and did really well in this research, and obviously his entire life with this contribution. But why don't you go into, I know there was a follow-up. I know they didn't get the results. And so let's just, not to put anybody down or not techniques down or anything, but just kind of look at objectively, what potentially could have been some factors of why, and really let's open this up.
Okay, do you want to compare the numbers real quick?
Sure.
So we can compare this study to that study?
Sure.
So the results after 8 weeks, there were differences in this paper. So the Bakris study, this paper, after 8 weeks, there were differences in systolic blood pressure of -17 plus or minus 9 millimeters of mercury for the NUCA versus -3 plus or minus 11 for the placebo. And that was for systolic. For diastolic, it was -10. So between -10 plus or minus 11, so for NUCA, and then -2 plus or minus 7 for the sham. And that was for this study. So what that equated to was a 2-drug combination therapy, basically saying, for someone who was on 2 medications to lower their blood pressure, they could get under care with Dr. Dickholtz, and those 2 medications would be matched with the corrections that they were getting from Dr. Bakris. They wouldn't necessarily need to be on those medications to get their blood pressure down to that level. Now, we did a follow-up study because the NIH approved, I think it was a fairly good chunk of money. I don't want to say exactly the number, but I heard some 6 digits there at one point, so I'm not sure exactly, but it was a lot of money. And that went to Palmer College of Chiropractic there in Davenport, Iowa, which is actually just down the road from Chicago. So there was a kind of a collaboration there. But this went into this is titled Effect of Spinal Manipulation of Upper Cervical Vertebra on Blood Pressure, Results of a Pilot Sham Controlled Trial. So this was a follow-up study to try to reproduce the results that Dr. Bakris and Dr. Dickholtz achieved. And this was published in JMPT, Journal of Manipulative Physiotherapeutics, in 2016. And this was done by Christine Goertz, Stacy Salisbury, and some other people that I don't know their names. I don't know who they are. So that usually says a bit when it comes to upper cervical, just because I know most of the researchers and upper cervical docs because I work with them on a fairly regular basis. But I don't know these people, and not to talk badly. They were doing, a technique that was not the same as NUCA. They were doing a toggle upper cervical technique, which is an older version of the upper cervical methods. And there are many docs who use toggle and get great results, but it is not the same as NUCA. And Dr. Dickholtz, with his 60 years of practice and his many, many years of training. So what I would say then, the results here, 51 participants, so kind of similar, hypertension stage 1. They were trying to lower the systolic and diastolic blood pressure, and results were adjusted mean change from baseline to week 6 was greater in the sham group. Systolic was negative 4.2 millimeters of mercury, diastolic was 1.6. Then in the spinal manipulative group, which was systolic 0.6 millimeters up and diastolic 0.7 millimeters of mercury up. But the difference wasn't statistically significant, so no serious, no conclusions could be drawn. And basically they said, our results do not support a larger clinical trial, which is a shame, because Dr. Dickholtz and Dr. Bakris did such a good job. That study should have been followed up by another NUCA doc that had the similar amount of certificate. I mean, it's hard to get that many years, but to get similar amount of years of experience and ability to correct the upper cervical spine. That way we could show continued, progress in this study, and it didn't happen here. And that is a shame to me as a diplomate of the craniocervical junction, as someone who is pushing for research. Dr. Leach and I talked about it earlier, that, we're all trying to do the best that we can. And if something comes up and it works better, we should try to use that. And this clearly didn't work as well. Many people might have their theories as to why, but Dr. Leach, do you have any thoughts on that?
It really makes me, and I haven't looked at that study as much as I would have liked at this point, but does it say anything about, obviously with the upper cervical chiropractic techniques that we do, holding your alignment is crucial. And obviously the more you're in alignment, the better your body is going to be able to respond. So I'm curious, and I'd be curious to see how many times they were adjusted, how well they were holding their alignment.
So
were pre and post x-rays taken to verify alignment? Like, there's a lot of different questions there.
I'll read you this paragraph. However, the striking blood pressure lowering effects of the previous study of Dr. Bakris and Dr. Dickholtz called for a well-designed clinical trial to evaluate further the efficacy and safety of cervical spinal manipulation for blood pressure management. Thus, our team conducted a pilot study with a more commonly used form of spinal manipulative therapy that also targets C1 and C2 vertebra, using research methodologies that were more rigorous and generalizable. Toggle recoil spinal manipulative therapy involves a non-rotatory high velocity thrust of C1 and C2. The thrust of toggle recoil spinal manipulative therapy differs from the gradual prolonged force application used in the aforementioned trial of Dr. Bakris and Dr. Dickholtz. Both techniques embrace the same therapeutic paradigm, although I would argue that they don't necessarily. Right. And I would say that's probably where the failure came in. But then it says that the alignment of the upper cervical vertebra with a carefully controlled manual force that may influence blood pressure via relaxation of upper cervical muscles. It doesn't really go into, it does say limitations here. Yeah, just the CHIP trials, this trial differs from the Bakris et al. In an important way that it may have impacted our findings. The participants did not have their blood pressure medicine washed out before the start of the trial. So I guess the start of the other trial, the blood pressure medication had been washed out with Dr. Bakris and Dr. Dickholtz. Although, you know, we might just have a different of opinion there because I think they're grasping at straws. I think that the changes were so dramatic in the other study that it would definitely call for this to be done again.
Absolutely, without a doubt. I mean, and any logical person is going to go through and look at the differences of this study and say,
yeah,
they're not just going to say, oh, well, it turns out that,
doesn't work.
Yeah, it doesn't work. It's like, that's ridiculous. It's like, okay, now let's go, let's look at the real conclusions of that study.
Yeah.
Whatever method and application of even the toggle recoil technique, whether it was from providers who were experienced or not, or doing it the right way or not, whatever, this study didn't reproduce that. But there's evidence from Dr. Dickholtz's study that it does do that. So it doesn't mean that, hey, it's done, let's not look at this again. Let's look and see, okay, well, maybe toggle recoil wasn't the best for this. I know full spine chiropractors that are doing traditional chiropractic rotary adjustments that help people with blood pressure. So again, it's not just, we're beating a dead horse here, but yeah, obviously this needs to be done again, maybe by, again, somebody board certified in the NUCA, realm, or somebody in the Blair, association that's been doing it forever. But it's like, it needs to be addressed again, and questions need to be asked of the methodology of that research and what potentially could have been wrong. What are the differences between that and the Dickholtz and Bakris study, and go from there. For patients that have high blood pressure and that they're concerned about taking medications and the long-term effects of what those medications, and they're looking for natural means, upper cervical chiropractic, NUCA, Blair, could be a very real possibility for them. So we would encourage them to give that a try.
Absolutely.
I remember back when we were in school and I was in school, I know that Dr. James Chestnut.
Yep.
Huge chiropractor in the research realm. He's a scientist. He's actually got his master's in in research methodology. So he's quite legit. I know he had a little bit of critique for this study, which I think is actually pretty valid, in the sense that there was only one marker. It was just high blood pressure. It was just a cause and effect. It wasn't looking at, is it restoring actually normal function?
Right.
Is it doing something different to the neurology that's actually lowering it? I don't want to put words in his mouth, but I know he had some criticisms of it. Do you have any thoughts on that?
Yeah. So, I think that's how it goes with this stuff, right? So somebody does a paper, they get great results, and everybody looks at it and they pick it apart, which is why we do research.
Right.
The fact that the results that were gotten at that time through Dr. Dickholtz and Dr. Bakris, that doesn't mean that was a bad study. It just means that, okay, they were able to get these results. Clearly, their patients were getting better, right? And they were getting off medication. So you can pick it apart. Dr. Chestnut, he does a very different style of chiropractic. I think Dr. Dickholtz was coming at it from a direction of the neck and its influence over the baroreceptors in the cervical spine and the maybe dysautonomia and the blood pressure in the skull. So there are many ways to do this research. You can pick things apart, and yes, I'm sure you could do it better.
I think his only point was, I think it was just with homeostasis and just the body regulating itself. It's like, you're only showing that you lowered blood pressure. You're not actually showing that it's more homeostatic, or it's more
that it's better
overall healthy, and that it's actually better. And it's like, it's a valid point, but it's like, yeah, but like it's been kind of shown that healthy individuals have a certain range of blood pressure.
Right.
We don't know exactly for that specific human being what exactly the blood pressure should be, but it seems
Yep.
like after this procedure is done, the body is able to then go into what seems to be more normal and more healthy. And so,
And this actually can go back to the pulse pressure findings with Dr. Kessinger. I think we did that paper, right? Pulse pressure findings. Yeah. So, they talk about all these HRV and pulse pressure and just heart rate and pulse as indicators of health, right? And so the question is, which one is the best indicator of health? How do you study it best? And I think it's all of it, right? And so, yeah, totally. You can, yep. There's different ways to do it.
Maybe just a last argument might be, well, that's exactly what a medication is doing. It's putting it back into the normal range, but by no means does that mean the patient's actually healthy now. I mean, I'm sure you've had patients be like, oh yeah, well, I have high blood pressure, but I'm on medication, so it's good. And I'm just like, no.
How about your headaches that developed right after you got on that blood pressure medication? Or how about the vertigo that you developed right after you got on that blood pressure medication, which I see that often.
Right. But I like, and I explain this to my patients too. I like the explanation of when we're doing an intervention that is seemingly has absolutely nothing to do with why you came in, and then the thing that why you came in is getting better. It's because we're restoring normal function, not because we're treating that, right? Like when you look at a blood pressure medication, like those things are going to, they're targeting for the end goal to reduce pressure, not to restore normal function. So there's a direct relationship between medication and lowering blood pressure. But when we just move a little bone in the neck and blood pressure goes down, you're like, whoa, like they seem completely not have to do with each other. But then when you look at it and you go, oh, okay, and you can actually look at the neurological mechanisms of why that is, then you can make those conclusions.
Yeah, absolutely. No, it's
anyway,
a great paper.
Anything else with this study? Anything important that you think we should review or touch on?
I did look up Dr. Gewirtz's credentials at Palmer, and she is no longer there. Interestingly enough, even though I know it was a few years ago, 2016, I think was when that study came out. But
and that was the follow-up. That was the
follow-up study.
Was she head research doctor on that, or?
Yes, I think she was the head of clinical research, principally as vice chancellor of research and health policy at Palmer. And Gewirtz to leave Palmer, legacy of 27 million in chiropractic research, shows she was really well known for doing research, but not necessarily for showing that type O disorders respond well to chiropractic. And she aligned herself with some organizations like the ACA that don't necessarily support the type of chiropractic that you and I use.
Right. All right. Any last questions before you get your question of the day?
Nope, hit me.
All right. Dr. Evans, what sports do you watch, if any?
Ooh, sports ball. I don't watch sports.
You don't watch sports? None?
No, I read research.
Yeah.
And token books.
Yeah. Yep. Yeah. You played sports, right? Did you play baseball?
Yeah, I played baseball as a kid, and then I played football and basketball, and I ran track in high school.
Yeah, I probably attribute football to all my spinal difficulties.
Definitely not all of them, but a lot of them.
A lot of them, for sure. Yes. A lot of them, and maybe even some of my concussive stuff.
Oh yeah, big time.
Yeah. All right.
Yeah, there's a study we should do on that chest impact and concussion in football, and it talks about the whiplash of the football helmet and what it like increases the speed acceleration of the neck. I think like 4 times or 40% or something like that. So it's like, you put a helmet on your head and you go hit people and you think, oh, I'll be safe because I have a helmet on my head, but actually it increases the acceleration of your cervical spine, which then causes more symptoms later. So anyways.
Does it, I would imagine they're looking at concussion, right? So maybe the helmet helps obviously with decreasing concussions, but then it actually increases
the
whiplash.
Helmet decreases head trauma,
Right.
blunt head trauma.
But not the whiplash part.
A plastic hat on and go hit people, but it doesn't help with whiplash.
Right. Right.
Yeah.
Cool. Awesome. All right, Doctor, thank you so much for your time, and we'll see you on the next one.
Awesome. Next time.
Thanks. Yep, for sure. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.